Welcome to another session in our telemedicine and digital health series. In previous lecture we covered the remote patient monitoring and Internet of Medical Things. Today, we will talk about a crucial topic that connects technology and healthcare: digital literacy and patient communication. As telehealth grows, it's not enough to have advanced tools. We must also ensure patients know how to use them effectively. So, what exactly is digital literacy? It's not just about knowing how to use a mobile phone or send a text message. Digital literacy means having the ability to use digital tools to find, understand, and share information effectively. In healthcare, this skill is becoming more important than ever. Here are some examples of what digital literacy looks like in action. Using mobile health apps to track symptoms, vital signs, or medications. Logging into patient portals to check appointments, access test results, or download medical records. Communicating with doctors through secure messaging systems or telehealth platforms. Accessing lab reports, electronic prescriptions, and trusted online health resources. When patients are digitally literate, they don't just wait for instructions. They take an active role in their own care. This means they can monitor their progress, ask better questions, and why does digital literacy matter in healthcare? Let's imagine a simple scenario. A patient receives an e-prescription, but they don't know how to open the file. Or another patient has a telemedicine appointment, but they can't join because they don't understand how to use the app. Situations like these are not rare, and they highlight exactly why digital literacy is so important. Digital literacy ensures that patients can access telehealth services without barriers, communicate accurately with doctors and nurses, build trust with healthcare providers, even when the interaction happens online. Without these skills, patients risk being left behind in a healthcare system that is becoming more. Now that we know why digital literacy matters, let's break it down further. What are the key components of digital health literacy? First, basic digital skills. This includes using a smartphone, sending an email, or simply opening and navigating a health app. Second, the ability to search and understand medical information online. Patients should know how to find reliable health information and avoid misinformation. Third, navigating healthcare platforms such as Sehat Kahani, Marham, or Oladoc. These platforms connect patients with doctors, book appointments, and even provide telemedicine consultations. And fourth, cybersecurity awareness. Patients must know what personal health information to share, what to keep private, and how to protect their data from misuse. Together, these skills form the foundation of digital health literacy. They allow patients to use technology with confidence and to participate fully. We've talked about why digital literacy matters and what its key components are. But we also need to recognize that there are some very real challenges when it comes to patient digital literacy. Many patients, especially those in rural areas or among the elderly, have little to no experience with technology. Even something as simple as downloading an app or joining a video call can feel overwhelming. Others may face language barriers or have limited education, which makes it difficult to read or understand digital instructions. And some patients may simply have a fear of making mistakes, worrying that they'll press the wrong button or lose important information. These challenges can create anxiety, lead to missed telemedicine appointments, or even cause the misuse of health apps and platforms. So, while digital health tools are powerful, we must remember that without the right support, many patients will struggle to use them effectively. This is why building digital literacy programs is just as important. Let me share a real-life example that shows just how powerful digital literacy can be in healthcare. A 55-year-old diabetic man living in interior Sindh was advised by his doctor to track his blood sugar using a mobile health app. At first, he was frustrated. He didn't understand how to enter his readings, and the app felt confusing. But then, his local clinic arranged a short digital training session. The staff showed him step by step how to log his sugar levels into the app. Very quickly, he got the hang of it. He began recording his readings every day and even shared the data with his doctor remotely. The result? His blood sugar levels became more stable, and unnecessary hospital visits were avoided. That's the true impact of digital literacy, turning frustration into empowerment, and improving patient. So, how do we actually improve patient digital literacy? The good news is, even small steps can make a big difference. First, clinics and hospitals should offer short training sessions. Even a 10-minute guide can give patients the confidence to use a health app or join a telemedicine call. Second, apps and platforms must be designed to be user-friendly, with clear, step-by-step instructions. Complicated menus and confusing layouts only discourage patients from using them. Third, we need visual guides and video tutorials, especially in Urdu and local languages, so that patients can learn in a way that feels natural and accessible. Fourth, involve family members, especially younger ones, in the process. Children and grandchildren can play a huge role in helping elderly patients navigate digital tools. The ultimate goal is simple: to make digital health accessible to everyone, regardless of their background or comfort level with technology. Because healthcare technology should empower people, not exclude them. It's not just patients who need to adapt, doctors, nurses, and health staff also play a key role in supporting digital literacy. Here's how they can make a big difference. Teach patients how to use digital tools during clinic or hospital visits. Recommend trustworthy apps and websites so patients don't fall into misinformation traps. Provide written or recorded instructions in simple, easy-to-follow language. Encourage questions and be patient when explaining digital processes. Because at the end of the day, if a patient doesn't understand how to use the technology, they simply won't use it at all. That's why healthcare providers are just as important as the technology itself in making digital health truly effective. So, what are the benefits when patients truly understand how to use digital tools in healthcare? First, they can make more informed decisions because they have better access to their own health information. Second, they participate actively in their treatment, instead of relying only on instructions from doctors. Third, digital literacy allows patients to communicate clearly with healthcare providers, which reduces confusion and builds stronger trust. Fourth, it helps reduce medical errors that might happen due to misunderstandings or missed instructions. And finally, patients feel more confident and in control of their health, something that is essential for long-term care and chronic disease management. These benefits don't just help individual patients. They also improve the overall success of telemedicine and digital health services, making healthcare more efficient and reliable for everyone. To conclude, digital literacy is no longer a luxury, it has become essential for modern healthcare. We are entering an era where telemedicine, mobile health apps, and remote monitoring are not just side options, but the backbone of healthcare delivery. Yet, these systems are only as strong as the patients and providers who use them. That means as we invest in advanced telemedicine platforms, we must equally invest in training patients to navigate them. Without digital literacy, even the most advanced tools remain out of reach for those who need them most. Digital literacy ensures that healthcare is not just digital, but also understandable, inclusive, and empowering. It bridges the gap between technology and people, turning complex systems into everyday solutions. For patients, it means the ability to communicate clearly with doctors, access care from home, manage chronic conditions, and avoid costly hospital visits. For healthcare providers, it means stronger engagement, fewer misunderstandings, and more accurate treatment outcomes. And for society as a whole, it means a healthcare system that is more efficient, equitable, and prepared for the future. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more insights on telemedicine and digital health.